welcome to the latest SpeakOut podcast from Aves Mental Health. I'm Karli Montague-Cardoso, the current chair of the European region of the network and the executive editor for open access journal PLOS Mental Health. As a person with lived experience of mental health conditions, a member of a peer support and advocacy network, and the lead of a journal that strives to serve as a platform for diverse, inclusive perspectives, I'm very aware that when it comes to diagnostic labels, experiences can vary greatly. For some, receiving a diagnosis is the starting point of a journey to wellness and recovery as an individual recognises it. For others, it can be highly detrimental, and for many, it's somewhere in between. And indeed, for many, carrying a label can both help and hinder, depending on their context. And so this is what we're going to be speaking about today. Usually our podcasts are hosted by and include members of Aves Mental Health only. Today we are still joined by some members of Aves Mental Health, but we're also joined by special guest Professor Nick Haslam. Nick Haslam is a professor of psychology at the University of Melbourne who works at the intersection of social and clinical psychology. He's published extensively and is best known for his work on dehumanization and concept creep. So concept creep is a term that he coined in 2016 and it's now very widely used, and it refers to a phenomenon that we're all kind of familiar with, but we may not necessarily be aware of the name for. And it's when there is a gradual semantic expansion of harm-related concepts. So for instance, harm-related words like trauma and abuse, and they will continually expand to cover milder or entirely new phenomena. Nick co-directs his university's mental health PhD program, and he writes frequently for a general audience. And he's actually recently published in PLOS Mental Health about the effects of diagnostic labels, and that will be coming into the discussion today. In terms of lived experience advocates from Aves Mental Health, we have Philani Kinyabo and Esenam Drah. Philani is a peer researcher at Succeed Africa, which is an international research consortium taking a bottom-up approach to investigate what works for people with psychosis in their communities. She's also a mental health advocate at Aves Mental Health, and she likes to fuse mental health with the creative arts. So, for instance, she's written and produced an original play that was showcased within Aves Mental Health called My Pink Walls. She is passionate about seeing lives changed through the work that she does. And we have Esenam from Ghana, who is a mental health advocate, speaker, content creator, and Vichy Fellow with lived experience of bipolar disorder. She holds a bachelor's in French and linguistics from the University of Ghana and has been actively advancing mental health awareness and disability inclusion since 2019. Drawing on her personal journey, Esenam has spoken at schools and churches and corporate organisations and across both traditional and digital media to challenge stigma and promote recovery. She's contributed to mental health research as a peer researcher and co-author with publications in journals such as PLOS Mental Health and Health and Human Rights Journal. And her lived experience also helped to shape the WHO's 2025 Global Mental Health Report. Finally, Esenam is the founder of Mental Health Quarters, which is a YouTube platform dedicated to sharing lived experiences and amplifying voices within the mental health community. And she's held leadership and advisory roles with organisations including the Mental Health Society of Ghana, Aves Mental Health, Ghana Samubi Jumaji, and Smiles of Hope, contributing to mental health and disability advocacy at both national and international levels. So thank you all for joining us today. And on to our discussion. So, as I said at the beginning, we know that there are pros and cons, benefits and risks when it comes to a diagnostic label. And this is probably the case from both a practitioner perspective and a service user or lived experience perspective. So I mentioned in the introduction Nick's recent publication with PLOS Mental Health, which is called Effects of Diagnostic Labels on Perceptions of Marginal Cases of Mental Ill Health. And it refers to diagnoses as mixed blessings. So from a bigger picture perspective, Nick, of someone who has a lot of experience with large data sets covering this topic, can you please elaborate on what you perceive these mixed blessings to be?
Yeah, look, and thanks so much for having me, Karli, and I'm really looking forward to the conversation with you and Philani and Esenam. about this really important topic. Yeah, I mean, the study we did, which was published in your wonderful journal, was fairly specific in its focus. It was looking at what the implications are for using diagnostic labels to refer to other people. So it's how we perceive other people based on whether a diagnostic label is applied to them. And particularly in cases where it's not obvious that they should be applied to them. So in cases where the severity of the condition that they're experiencing may not be particularly severe. So, just as background, we did simple experiments where some people read a description of someone without a label, and other people read exactly the same description but with a diagnostic label. And it might be bipolar or PTSD or OCD or things like this. And we then just compare uh, the judgments of people who read the version with the label versus those who read the version without the label. And in terms of the benefits of the label, we found that people tended to report experiencing more empathy and warmth towards the person who received the label. And remember, the only difference between the two conditions is whether there's this diagnostic label or not. They also were more supportive of that person receiving accommodations or adjustments, extra time on exams, extra leave if they were at work, other kinds of adjustments to make their life better and easier. And they also thought the person was more suitable for receiving some kind of treatment resources. So these are all positives: greater warmth, greater support, greater recommendation for receiving some sort of clinical intervention. On the cost side, we found that in the label condition, people tended to think that the person with the label had less control over their challenges and problems and were less likely to recover from them. There was a sense that the label implied that the problems being described in the vignette were long lasting and hard to do much about. And I think in terms of the bigger picture, which is what you asked about, I think this is really aligning with a lot of what we know about diagnosis having both pros and cons. So, on the pro side, often people will say, I do get more support from people. They think that the things I'm experiencing are legitimate and not just all in my head. Often the diagnosis will give people a sense that they finally understand themselves or have a framework to account for the experiences that they're having. Often people will say the diagnosis gives me a sense of community and belonging with the other people who share my condition, and maybe there are support groups and other kinds of information that gives you a sense that you're not alone with this experience. And of course, it also gives access, ideally, to resources or treatments. So there's those benefits to diagnosis in some cases. But as you say, it's a double-edged sword. So, of course, once there is a label, there is the possibility of being discriminated against on the basis of that label, distressingly common experience in many people's life. There's often a sense of internalized shame because you take on board the negative stigma, the negative stereotypes that are still associated with a lot of diagnostic labels. So often people will feel worse about themselves in some level when they have the label because of all of the stigmatizing baggage it carries. It can also, I think, lead people to be more pessimistic about recovery because people often think that the diagnosis implies that this is who they are forever. So it can give them a sense of who they are, but also sometimes a sense that this is something that they can't recover from. And I think sometimes people are concerned, just finally, that sometimes labels become sticky and they can actually be self-fulfilling. So in some cases, maybe not very many, there's a concern that applying labels where maybe they don't belong can lead people to develop problems they did not have previously. So I think that's what I meant by mixed blessings, this sort of complicated combination of pros and cons.
Thank you, Nick. Yeah, picking up on what you said at the end there about labels being sticky, we also recently published a piece that was in response to suggested changes in the DSM and the effects of a diagnosis, and how some individuals experience when they receive a diagnosis, not just viewing their past through that diagnosis, but then shaping their future and their behaviours around it. And then that leads to other problems that they didn't have before. So what you're speaking about is definitely something that others have shared as well. And I think it's really interesting as a mental health advocate, we often think of our own experiences with a label. And it's, I think, less often you hear about people's perception of others who have a label. So I think your recent work that you published with us is really an interesting angle. I'd like to turn to Philani and Esenam now, because obviously, as I said, with Nick's research that he referred to at the start, he refers to about the perception that others have of someone with a label. What has been your personal experience of receiving a diagnostic label? And was that a uniform experience, or did it vary depending on, say, setting and context? So maybe I'll start with Philani first.
Okay. Thank you so much for having me here. I think for me, when I first got the label, I didn't know what it meant. I did not know what it would entail. So I first had to understand it for myself in order for me to then tell other people or inform other people about the label that I had. And the people who were really close to me when I told them about the label, they were very, very understanding, and um, they really cared about me and wanted to know more about the condition as well. I remember my family members went and they started even doing research about my condition. They wanted to know how they can help me, how they can make the situation easier, how they can be there for me. So they did research and they even asked me questions as to how they can help me. So that label, I wouldn't say it helped them understand me more, and it helped me understand myself more because I did not understand my actions. I didn't understand what I was going through. So therefore, it helped me understand myself and helped other people understand me and know how to conduct themselves when it came to my condition and who I was. And also with other people who are not so close, I find that people are okay with it. Other people, they actually don't even know what it is. So they'll be like, oh, okay, so you've got this diagnosis. And they really don't know what it is unless you explain or they go and do their research. Some people just it's just, oh, okay, it's like, for example, other people will be like, oh, it's just like diabetes, something that you have to control or something that you have to maintain in life, something that you have to do, something that you have to just, not recover, but be able to live with. So it just depends on the context. I've never really had bad experiences where I can say I've told someone or told a community and they have not received it. I think also I'm very careful as to who I tell. It's not everyone that I just disclose my life to or the condition that I have to. It's not everyone who knows. And also, it just depends on the context where I am and whether I feel comfortable enough sharing. There's some spaces where I just don't feel comfortable enough sharing because I know that there'll probably be discrimination or stigma attached to it, attached to the label. So it's best not to share. And there's some spaces where I feel very comfortable. And I find that the label is something that people can help get to know me more from than and they get to know who I am through the label.
Thank you, Polani. I'm pleased to hear that your experience overall has been a positive one. And I think you bring into interesting points there about, first of all, actually understanding what that label means, because I think the way we learn and interpret what that label means can have a huge impact on our experience, as is the way the people around us interpret and understand that label. And I think you also kind of touch on there's this, I wouldn't say a hypervigilance, but in some cases it can be a hypervigilance. Once you have that diagnosis, constantly trying to assess, okay, who do I trust with this? Who can I feel comfortable with this? But I think that same applies for any condition really. But I'm really pleased to hear that your experience has been overall positive. Esenam, how's your experience been with your diagnosis?
Okay, so for me, I was diagnosed in 2015. I started having my symptoms in 2015, and it's been 11 years, and I can boldly say that it's been, I've been a recipient of mixed blessings. I'm saying this because when I initially got diagnosed, I was diagnosed with schizophrenia. And I just did not want to accept that label. I did not care whether it was schizophrenia, bipolar. The fact that I have been diagnosed with a mental health condition meant that I have a death sentence on my head. My life is over. I wouldn't be able to graduate. I wouldn't be able to be successful like my friends. Because I do not have a lot of knowledge about mental health, but the little knowledge I had was um, when your mental health is affected, nothing goes on well in your life. I was comparing myself to the people I was seeing on the streets, and I did not know that you can have a mental health condition and still thrive. And so, first, I got diagnosed with schizophrenia. I wasn't happy. Then, later on, a few weeks or months later, I saw a new psychologist and I was diagnosed with bipolar disorder. She tried her best to make me understand that it was not a death sentence, but it was just not working for me because at the time I was 21. I was just looking at my other friends. Okay, my other friends don't go for therapy, they don't take medication, they don't have to adjust their life to be able to, live with this condition. So why does this have to happen to me? At a point I was even thinking that maybe I was being punished by God. And I kept asking, okay, if I'm being punished, what did I do? And so for a whole year, I was in a state of denial. My symptoms got worse. And now a lot of people on campus that time, especially my roommate, did not empathize with me. I think I told her about the condition. I did tell her, but she did not empathize. She didn't care because at the time, my symptoms were affecting her. My behavior was very, very erratic. I was just, not the easiest person to live with. And personally, I lost a lot of friends around that time. My grades came down, it took a nosedive. I just, a lot of my life just turned upside down. So that was when I was even explaining to my psychologist that, you see, this your label, this diagnosis you have given me. Maybe if I didn't even know about it, maybe my life would have been better. But now I have this label. I know what is going on in my brain, and now everything is not going on well. For my family, they were very understanding, supportive. They went with me for every appointment. It was even when the symptoms started, my mom took me to some churches to be prayed for. And when my condition wasn't getting better, that's when my father suggested that we seek professional help. And we began the journey of, my road to recovery. And for them, they did not see it as anything strange. They were just glad that, now we have been able to get some closure and understand what is going on here. They bought my medications for me. They encouraged me. They loved me, supported me, and all of that. But when it comes to the mixed, why I said I've been a recipient of mixed blessings, I got fired from my job in 2019. And before that, I was living in, I did not see how getting that label of bipolar disorder will bring me any trouble in life, because everybody around me had been supportive and understanding, especially when I was taking my treatment seriously. So I was well for a long time. Everybody saw that, oh, I was thriving, I was doing well. So with this job, I opened up to a member of management, and she went and told other members of management. I was called for a meeting and asked, okay, this person said you have this condition. Can you tell us more? And I explained to them that this condition, I got diagnosed in 2015. I have been able to, graduate. It's not something that limits me, but it was not enough. And I know if I had told them maybe I had cancer or diabetes, in Ghana here, we are usually really empathetic towards, those type of chronic conditions. But when it's mental health related, there's this issue of stigma where, okay, now you're not good enough. Okay, what if you come to my school and teach our children? I remember there was a statement the school counselor made that day. He said, people like me who have bipolar disorder should not be allowed in the classroom to teach. We could be dangerous, we could be violent. And that statement alone was, like a sword driven through my heart, because for years I did not see myself that way. But because of my diagnosis, now all of a sudden, the way I used to come to school looking nice, looking good, socializing with everybody, teaching, now they have just forgotten everything I was doing just because of that label. But I can say that for the years after my state of denial, I think that receiving that diagnosis helped me to be serious with my treatments. I knew that, okay, there are medications available, there's therapy available, I need to take my life seriously. It has also given me the chance to, meet other people who have mental health conditions, because for the first few years of my journey, I did not have any friends who had mental health conditions. So it felt like a very lonely road. But when I started doing advocacy, I got to start meeting other people, peer support, different networks, mental health communities, locally and internationally. And I'm glad that because I know my label, it has given me this sense of belonging and this opportunity to work for the cause. Now, if you ask me if the label of bipolar disorder bothers me, even after getting fired from my job, I'll tell you, no, it doesn't bother me. I'm just glad that at least I know what is going on and I've been able to manage the condition. I meet some people sometimes and they tell me they wish they had known years ago what was going on with them. Certain things wouldn't have happened to them if they knew. So that's when I see it. Okay, it's been a blessing that actually when my symptoms started a few months after, at least I got my label. The first one was wrong, but at least it did not keep long and I got to know the correct label that I was given, which was bipolar disorder. Thank you.
Thank you, Esenam, for sharing that, for being so open. And I'm pleased to hear that your family was supportive, but obviously I'm so sorry to hear like some of the nasty stereotypes and stigmatizing experiences that you had. I think there's a few things that come up from this, and touching on what you said earlier in your account, the diagnostic labels is quite, at least in my experience, I've had several labels given to me, and so I don't know how much I trust them, but it's that constant, because there's so much overlapping in terms of symptoms with mental health conditions. The likelihood of someone being given the wrong diagnosis initially is quite high, and so that can have an impact on their journey. And obviously, where you are and local attitudes and understanding of mental health are really going to have a huge impact on your journey. And so obviously, when we're talking about the effects of labels, we do have to be mindful that a lot of that is heavily impacted by where you are located. But thank you both for sharing your experiences. So back to Nick, having heard some of these lived experiences, obviously that definitely somewhat fits with your overall impression of the mixed bag of mental health conditions. But having heard these, or considering the future direction of your work, what additional avenues do you think could be explored with respect to the impact of labels?
Yeah, I mean, those were really powerful stories of personal experiences, and I think they do highlight that there are positives as well as negatives. I think often, at least in the academic world, you hear mostly negative views on diagnosis, so it's always good to hear people acknowledge that they received some sort of benefit, that they felt a sense of understanding or belonging, as Esenam was just saying. In terms of where to go in future, look, I think one of the things that's very interesting, and I think hasn't really been addressed enough, is the context of how many other people share that particular label. So again, I was just taken by how Esenam said that when she received her diagnosis, I mean the second one, there were very few people she was aware of who had that. And I think the loneliness of that experience versus the sense of belonging to a community with many people who share that kind of experience or that label probably makes a big difference in terms of how it's perceived. So I'd like to see more work going on in future to do with people's beliefs about whether their diagnosis is widely shared or very rare. And I'm not aware of there being much of that kind. And I think it's really important. I think another thing that really shone through with both of your other guests is the issue of how the nature of the relationship makes a huge difference to how your diagnosis is considered. So in both cases, there was lots of love and support from close family and close relatives, although, again, you don't always hear that. Sometimes even loved ones are not supportive. Whereas often people who are in workplaces or who are more distantly related were a lot less encouraging and were often actively discriminatory. So I think more attention to how stigma is not just something that's abstract or general. It really depends on how it's expressed according to the closeness of the relationship you have with people. I think it'd be good to see that. And a third thing that I think came through is for want of a better word, culture, which, because I'm sure this will vary across different parts of the world. What is the mental health problem seen as like? Is it seen as like diabetes, which is one of the examples? Is it just seen as a kind of chronic condition that you manage, no different from any other sort of health concern? Or is it seen more almost as a form of criminality, as Esenam said, in terms of being sort of too violent, supposedly, to teach in a school? And that's going to differ according to different diagnostic labels. It won't be about diagnosis in general. It'll be about particular labels. So as we all know, schizophrenia in particular has this long mistaken association with violence and unpredictability. But that won't be the case for depression, for instance. And so I think having a bit more research into the impact of diagnostic labels based on what kind of condition you're talking about and whether it's seen as being just like any other kind of health condition or whether it has all of these other meanings would be great to do. I mean, look, I'm still thinking through all the implications of this stuff, but it's certainly very rich.
Thank you. Yeah, there's definitely a lot to think about and an awful lot of factors that can influence someone's experience with receiving a diagnosis. And as you say, that one that we don't really tend to think about much is how common that diagnosis is, and therefore how that can not just impact the understanding that other people have, but that sense of belonging as well. It can be quite lonely to feel that you have a diagnosis that not many people have. So to finish off now, I've got a question for all three of you, and it's kind of related to what I've just asked Nick. So I'll go to Philani and Esenam first, and I'd like to finish off with Nick. Obviously, there are issues with diagnostic frameworks at present because we don't fully understand the implications of receiving a diagnosis for everyone. And as we've seen, it's a mixed blessing. But of course, it would be irresponsible to discard them because they're helping so many people. But it would also be irresponsible to avoid reforming them and refining them. So where do you think we go from here to ensure that the benefits of receiving a diagnosis, the signposts to support are still there, but the risks and harms are avoided? What would be the one thing that you think we could do to improve how these diagnostic frameworks are impacting people's experiences? I'll start with Philani.
Thank you. Thank you so much, Karli. I think for me, one thing that we could improve is I'm not going to just talk about the frameworks, but it's about what happens when someone gets a diagnosis. I think one thing we need to put in place are pillars or support networks that can help someone with a diagnosis. For example, when I first had my diagnosis, I was so confused. I was confused. I did not understand what was happening to me. I did not understand what was going on in the world around me. I did not understand what I did. There were some elements that I did. For example, I was screaming, I was shouting, things that I never did before, but I did not understand what was going on. I did not understand what happened to me. So I think with the diagnosis and the frameworks, what we need is support. If only there were places where, for example, you get a diagnosis and you go to where there are other people who have experienced similar experiences to you, can talk to you about what you have gone through, talk to you about what it means to have a diagnosis, talk to you about their experiences as well, so that you get an understanding. I was in the wilderness. It took years for me to understand what exactly, and even up till now, there are certain elements that I don't understand. But I feel if a person has a diagnosis and has a support network, a place where they can go and talk about their experiences, and also with that support network, have people who also talk to the close family members, close friends and family members about how to go about the diagnosis, how to treat the person, what to do. For example, like when I had my manic episode, I would have loved to know what I actually did, because some elements I remember, some elements I don't. So it would be nice to say, okay, fine, I have a diagnosis, but I would love a support network, people to say, okay, this is what happened to you, this is how things happened. And with that, it would have helped me piece together things that I did not understand that were happening to me at that time. So I think, yes, we have these frameworks, we have these diagnostic frameworks, and as we have talked about that, a diagnosis is sometimes a good thing and sometimes a bad thing. But I think we need to add some things, support networks, support for us, so that when people do get diagnosed, they know where to go, and they have a community, they have people to talk to, people to help them through the journey that they're going through.
Thank you. Yeah, I think, again, this is something that may vary depending on location. I mean, for instance, in the UK, we have some networks and charities certainly could do with a lot more support than they get. And I know that there's probably a lot more than there are elsewhere, but I think what you're speaking to is that post-diagnosis support. There's this huge journey to even get to a diagnosis. And then, as you say, many are just in the wilderness. And yes, they're given their medication or their therapy, but then in terms of navigating how that changes their life, that tends to be missing. So I totally agree that that support, that peer support after you receive a diagnosis is something that really needs to be ramped up and formalized. Esenam, what would you say would be the one thing that you would change so that we still, we retain the benefits of getting a diagnosis, but we limit the harms or the risks?
I think for me, I remember when my first doctor broke the news to me and my family. How he went about it was very difficult for me. Maybe for him, he saw it like, oh, it's just another day in the consultation room, just, telling someone that they have a condition. But for me, I saw it like the last day of my life. And I remember during the consultation, my mom asked the doctor a question. He seemed very nonchalant. She just asked him that, oh, so now that she's starting a medication, will she be able to go to church? I wish he had just told her, oh, maybe, mommy, for now, she will just need a few weeks or a few months, to stay at home because the medication will knock her out. It will be drowsy. So she just needs to be at home. He did not respond to her in that way. Like, I felt like he was even rude to my mother. He just said an outright no. He didn't explain to us why maybe for some time I may not go to church. And that church was my happy place. I'm someone who loves going out. And so when now you have just dropped a diagnosis on my head, and then my mom asked a question, and I just felt he was so nonchalant and lacked empathy. And for those few months after the diagnosis, I just had this misconception that psychologists, psychiatrists, they are not good people. They are just out to get your money. You are just another patient client. They don't think about you. It was meeting my other psychologists who introduced me to my psychiatrists that made me understand that there are some of them that actually care. So I don't know what needs to be done in terms of maybe training, but I think that the psychologists and psychiatrists need to be taught how to break news. Especially, I know medical doctors are taught how to break bad news, maybe when a patient dies. I think that same seriousness should be attached when you are breaking a diagnosis, and also explain or answer certain questions in a very nice way. And I think we should also normalize conversations surrounding mental health. That is one of the reasons why I started my YouTube channel, Mental Health Cortex, because I realized that for years I did not know what was going on with my mental health, and I made so many mistakes which could have been avoided if maybe I saw another person like me sharing my story. Yes, I watched videos of other people in other countries, and but I did not have like my local African context to resonate with, and so it's made my journey quite turbulent. So I wish that more people with lived experience. I'm not saying like everybody has to come out and share their story, but if you can or you want to, just go ahead and share. Recently, I checked my Instagram messages, and a girl sent me a message telling me that she decided to go and seek professional help because of some of the videos that I have done. I have even shared a video where I shared my appointment, my journey to seeing my doctor, just to show people that some people, for example, in Ghana, some people have this misconception that psychiatric hospitals are like really, really like scary places. When you go, you see people screaming and shouting, they are restraining people. I just made them, like, took videos. I didn't show anybody's face, but I made them see that, oh, it's like going to a regular hospital, going to see your dentist, going to see your gynecologist, just, a regular appointment, just to, change those ideas that seeking professional help is very, it's very scary, and it's not a pleasant experience. So for me, those are some of the things that I think need to change, and it would really go a long way to help us. Thank you.
Thank you. Yeah, absolutely. That the second answer kind of echoes what Philani is saying with that support and visibility after receiving a diagnosis, and that can increase that sense of belonging, but also encourage others to get help. And I'm also sorry to hear of the experience that you had with the initial psychiatrist, and absolutely the way in which some communicate with patients. It needs to be a lot more sensitive, a lot more understanding. But I think a lot of that is probably based on expertise and resources, and this would be a whole other conversation. So finally, Nick, I'm especially interested to hear, given the extensive work that you do in this field, what would you say would be the one thing to change to ensure that we, maintain the risks, maintain the benefits, but limit the risks?
Well, it's easier said than done, but I think a lot of the costs of diagnosis, a lot of the downsides come from inaccurate knowledge. So yes, peer support's important, as Philani said, and yes, professional training to improve communication is important, as Esenam said. I think a lot of the downsides, a lot of the discrimination, a lot of the shame, a lot of the pessimism that you get from diagnosis is because people don't have accurate knowledge about things. So, I think the psychiatrist was not just rude, the psychiatrist was wrong. The advice wasn't good advice. But I mean, in terms of the wider population, greater awareness, greater familiarity will reduce some of these stereotypes, will reduce people's mistaken beliefs about dangerousness and unpredictability. And you would hope that with a more mentally literate society, in one's own context, not just information from other parts of the world necessarily, will improve people's attitudes and humanize people who are experiencing these conditions. And I think there are two issues. I know I'm only allowed to suggest one thing, Karli, but in some places or with some groups of people within society, the problem is not enough information, not enough information. They just simply are ignorant, and they're still in the under the sway of inaccurate stereotypes, or they're just completely unaware. And then I think the other problem we're facing, I think in Australia at least, is too much information, if you like, too much inaccurate information. So I think some of the diagnostic information available, for instance, on TikTok or some channels, is spreading misinformation, which also isn't helpful. So I think what we need is just more good, accurate information to boost population mental health literacy.
Thank you, Nick. Yeah, we could spend another 45 minutes talking about misinformation and the dangers of it. As you said, I see this in the UK as well. The availability of too much information ends up having the potential to be misunderstood, misused, and in some cases it adds to stigma. It adds to delaying seeking support. And so it's a really fine balance. And this is why I do think journals have a role to make sure that what goes out there is accurate, and a lot of people are getting that information from social media, and so journals and researchers need to be there too, making sure that the information is accurate. But that is a really good point, and I could say a lot more about that. But thank you so much, Nick, Philani, and Esenam, for joining me today and sharing such interesting perspectives that I'm sure all listeners will be able to relate to and indeed add to as well. As ever with mental health, it's not a one-size-fits-all. Receiving a diagnosis, whether it's put upon us, whether we choose to start the journey to obtaining one, is a mixed blessing for many. In some respects, as we've heard today, it adds to stigma. It may shape who we become, and what we do in a way that's not compatible with our own wellness. But in other respects, it can save someone's life and set them on a road to empowerment and what they consider to be their recovery. And I think the more we create a space for these experiences and perspectives, the more we can understand not just the needs of others, but maybe our own needs too. So thank you again for joining us today. Please do take a look at Nick's paper in PLOS Mental Health, and please take a listen to the other SpeakOut podcasts that you can find on the Aves Mental Health YouTube channel. So thank you for listening.